Tonight on Our Story,
I think there's a pervading belief in our culture that somehow a mental illness is a symptom of a weakness of character, and it's not.
a story about breaking down the barriers of ignorance regarding the mental health community.
We're people with dreams and hopes and desires and wants and needs like anyone else.
A story of redemption and recovery.
I don't know where I would be today if it wasn't for, the grace of God planting me where He planted me.
And a story about creating solutions and changing lives. Easter Seals has a long history of helping children and adults with disabilities. And I personally have a long history with Easter Seals, hosting their annual telethons for many years on Local 4. But many people may not realize that Easter Seals has grown through the years to be one of the key providers of community mental health services in Oakland County. May is National Mental Health Month. What better time to get rid of the stigmas and misinformation surrounding this devastating diagnosis? Recently, the Oakland County Community Mental Health Authority staged its 6th annual Recovery Conference. And people from all over the area came here to share stories of hope and healing.
Recovery requires help and support of other people, whether it be from substance abuse problem, or whether it be from a mental illness, whether it be from a physical illness. It requires support of other people. We can't go it alone.
At the conference, Bob Dillaber conducted a workshop on recovery from substance abuse and mental illness. It is a path with which he is intimately familiar.
I just totally collapsed. I wasn't able to function at all. Went into a deep depression. Couldn't come out of my basement. Didn't answer the door, didn't answer the phones, and the only thing I really cared about was dying. That was probably the most difficult experience that I ever had to go through. Ended up, as a result of that, in the hospital. One of many hospitalizations, actually, a total of 7 over my lifetime that I've experienced.
To fight the depression, Bob turned to street drugs, a common pattern in the mental health community.
When your mind is going 100 miles a second and you do anything you can to shut the mind off, taking a substance, whether it be alcohol or marijuana or street drugs, is a way to try to self-medicate, to try to stop that insane, the insane thoughts that are racing through your mind at such an extreme.
Bob's story is not that unusual. 1 out of 17 Americans suffers from a serious mental illness. And mental illness affects 1 out of 5 families.
Well, first and foremost, my heart goes out to those individuals because it's a very, very scary time. You don't necessarily know what's going on with your loved one. There's a lot of questions, but be rest assured that there's answers out there. There's treatment facilities such as Easter Seals who can help your individual overcome their mental illness and recover. And recover is possible. We've seen it. There's living examples of it here today, so it's definitely something that can be obtainable.
Oakland County Community Mental Health Authority has a number of services for the mentally ill, including this weekly woman-to-woman support group. For consumers like Donna Harris, who suffers from bipolar disorder, recovery is only possible with open communication and support.
We share our experience, strengths, and hopes with each other, and we sometimes cry. We give each other suggestions and feedbacks. We don't co-sign anyone's mess. We let them know, wait a minute, your thinking is not in line with your actions. And it's just a good group. It's a good group. I can't see not being a part of it. Easter Seal has given me a lot of confidence, a lot of hope. So I know that I can call my case manager and tell her I'm not feeling right. She'll come and sit and talk with me. She'll go the extra mile to make sure that nothing negative happens to me.
Donna Harris calls this group family. And without the love and support of family and friends, the chances for recovery are severely diminished.
It can definitely hinder the recovery process if they've lost touch with family and friends who have not understood the illness, or if they've burned their bridges with their contacts. It's very isolating. Thankfully, we have groups that are involved in the community and at our particular agency, Easter Seals, that involve consumers with each other so they can start networking and building relationships that way.
Bob Dillaber's mission is to help people find the road to recovery.
In doing my support group for 8 or 9 years, I've learned how to deal with people that come in maybe for the first time. They're maybe feeling ashamed or feeling bad about having to be there and having to get help. The best thing you can do is to ask questions. Tell me more about what your situation is. What are you feeling in life? What kind of experiences are you having? How is this affecting your life? Being someone that's interested in what they have to say, question them, ask about it, show an interest, and then support it. And then if you can, help them to find support and help that may let them move along in a positive direction.
What recovery means, very simple, is getting better, is functioning better. And with any illness, whether it's physical illness or mental illness, we want to help people recover. And too often in the past, the public at large, and even mental health professionals, would sometimes carry the same stigmas that the public has, is that mental illness isn't treatable. It's not definable, it's not treatable. Let's ship this person off to some institution, which unfortunately we did too often in the past, where there was no recovery. People were gone. They were out at that state hospital for the rest of their lives. We don't do that now because we have the tools to intervene in ways that help people recover.
I tried to go it alone when I was in my basement sobbing and wouldn't answer the door. I was totally isolated. I couldn't get better. The only way I could have gone was down further. But when I reached out and I got help and found that there were people there to help me, it made all the difference in my life. It turned my life around.
We have an illness. We have an illness. This happens to be in our brain. We have a chemical imbalance. I would like to just break that stigma of thinking, because people, especially if you're on disability, they'll say you're getting a crazy check. You know, we're not crazy. We're not crazy people. We're people with dreams and hopes and desires and wants and needs like anyone else. We're human beings. We just have an illness.